Imagine a silent enemy lurking within, one that you can't see but that has the power to change your life forever. This adversary is no fiction, it's a reality for countless men across the globe: prostate cancer. A topic of immense importance, it holds the potential to impact lives in ways one can't foresee. The key to battle this silent enemy is knowledge, and that's what we're here for. So, are you ready to dive in? Stay tuned to uncover the truth about this silent enemy. Prostate cancer is a term that might seem intimidating, but we're here to break it down for you. Let's start with the basics. What is the prostate? The prostate is a small gland that sits below the bladder in men. It's about the size of a walnut and forms a vital part of the male reproductive system, producing seminal fluid that nourishes and transports sperm. Now, let's delve into the term that has brought us here: prostate cancer. It's a condition where the cells in the prostate gland start to grow uncontrollably. It's important to note that not all growths in the prostate are cancerous. Some can be benign, which means they aren't cancer and won't spread to other parts of the body. But when the growth is malignant, that's when we term it as prostate cancer. So, how does cancer develop in the prostate? Well, it all begins with the cells. Normally, cells grow and divide to form new cells as the body needs them. When cells grow old or become damaged, they die, and new cells take their place. But sometimes this orderly process breaks down. When this happens, cells do not die when they should, and new cells form when the body doesn't need them. These extra cells can form a mass of tissue called a tumor. In the case of prostate cancer, these tumors can either be benign or malignant, as we mentioned earlier. Benign tumors aren't a threat to life and don't invade the tissues around them or spread to other parts of the body. Malignant tumors, on the other hand, can invade nearby organs and tissues, such as the bladder or rectum, and can spread to other parts of the body, causing what we call metastasis. Prostate cancer might sound daunting, but knowledge is power. Let's power up. Now that we know what prostate cancer is, it's time to understand who's at risk. Firstly, age plays a significant role. Prostate cancer is uncommon in men younger than 40, but the chance of having prostate cancer rises rapidly after age 50. About 6 in 10 cases are found in men over the age of 65. Family history is another key risk factor. If your father or brother had prostate cancer, your risk is 2 to 3 times higher than the average man's. If several of your family members have had prostate cancer, and especially if it was found at a young age, the risk can be even higher. Diet and lifestyle can also influence your risk. Some studies suggest that men who consume a lot of red meat or high-fat dairy products and fewer fruits and vegetables may have a slightly higher chance of getting prostate cancer. These men also tend to consume fewer fruits and vegetables, which could further contribute to their risk. Physical inactivity might increase prostate cancer risk. Regular exercise has been linked with a lower risk of developing prostate cancer. Exercise improves overall physical health and well-being, and it helps to maintain healthy weight. Certain genetic changes may increase prostate cancer risk, but these inherited mutations are thought to account for a small fraction of prostate cancers. However, if you have a strong family history of prostate and/or breast cancers, you may have a higher risk of developing prostate cancer. Race is also a factor. Prostate cancer occurs more often in African American men than in men of other races. African American men are also more likely to be diagnosed at an advanced stage, and they are more than twice as likely to die of prostate cancer as white men. However, the reasons for these racial and ethnic differences are not clear. Knowing the risk factors helps us stay one step ahead, but how can we detect it? Early detection can be a game changer. Let's delve into how prostate cancer is detected and diagnosed. So how do we know if something is off? Well, prostate cancer doesn't always come with a flashing warning sign. Sometimes it sneaks in silently, showing no symptoms until it's advanced. But more often than not, subtle changes can point towards something brewing. These include frequent urination, especially at night, difficulty starting or stopping urination, and discomfort while sitting. Painful ejaculation and blood in urine or semen can also be indicative. It's important to remember, though, that these symptoms don't automatically mean prostate cancer. They could be due to other benign conditions, but it's always worth getting checked out. Let's talk about diagnostic tests. The PSA, or prostate-specific antigen test, is a simple blood test that measures the level of PSA in the blood. A higher level could suggest prostate cancer, but again, it's not definitive. Other factors like age, race, and certain medications can also affect PSA levels. If the PSA levels are high, or if the doctor feels an abnormality during a digital rectal exam, a biopsy might be the next step. This involves extracting small samples from the prostate and examining them under a microscope. It's a straightforward procedure, though it might sound a bit daunting. Two other tests that may be used are the MRI and the ultrasound. An MRI can provide a detailed picture of the prostate, aiding in the detection of cancer. The ultrasound, on the other hand, can guide a biopsy needle into the right area of the prostate during a biopsy procedure. A diagnosis of prostate cancer is not made based on one single test. Instead, it's a combination of results from different tests, the person's symptoms, and their medical history. It is a meticulous process, ensuring that the diagnosis is as accurate as possible. Early detection is key, but what happens after diagnosis? Let's explore this in the next segment. A diagnosis can be overwhelming, but remember, every problem has a solution. When it comes to prostate cancer, there are numerous treatment options available, each tailored to the individual's needs, health status, and the stage of the disease. First, let's talk about surgery. A common surgical procedure for prostate cancer is a radical prostatectomy. This involves the removal of the entire prostate gland and some surrounding tissue. It's a major operation, but it can be highly effective, especially if the cancer is localized and hasn't spread beyond the prostate. Now, if surgery sounds a bit too daunting, there's also radiation therapy. This treatment uses high-energy rays to kill cancer cells or slow their growth. It can be delivered externally, where a machine directs the radiation at your cancer, or internally, through a method called brachytherapy, where radioactive seeds are placed directly into the prostate. Next on the list is chemotherapy. This is typically used when the cancer has spread outside the prostate gland. Chemotherapy uses drugs to destroy rapidly dividing cells, including cancer cells. It can be administered intravenously or taken orally. Hormone therapy is another option, used to reduce the levels of testosterone in the body. Since prostate cancer cells need testosterone to grow, cutting off its supply can help slow the growth of the cancer cells. There's also a newcomer on the block: immunotherapy. This exciting field of medicine uses your body's immune system to fight cancer. For prostate cancer, one form of immunotherapy removes some of your immune cells, tweaks them in a lab to fight prostate cancer, and then infuses them back into your body. Each of these treatment options has its pros and cons, and what might be right for one person might not be right for another. That's why it's crucial to have an open, informed discussion with your healthcare providers. They can guide you to the best decision based on your personal circumstances. We've tackled detection and treatment, but how can we prevent prostate cancer? Prevention is better than cure. Let's discuss how we can potentially prevent prostate cancer. The first line of defense is regular screening. By keeping up with routine checkups, you can detect any abnormalities at an early stage, increasing the chances of successful treatment. Next, let's talk about lifestyle changes. A healthy diet is crucial in the battle against prostate cancer. Focus on consuming a diet rich in fruits, vegetables, and whole grains. Cut back on processed foods and red meats. Consider adding foods high in omega-3 fatty acids, like fish, to your diet. Exercise is another key player in prevention. Regular physical activity can help maintain a healthy weight, which reduces the risk of prostate cancer. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Limiting alcohol consumption and avoiding tobacco can also contribute to a lower risk. However, it's important to remember that these preventive measures do not guarantee immunity from prostate cancer. They simply decrease the risk. In summary, prevention of prostate cancer revolves around a combination of regular screenings and healthy lifestyle choices. We've empowered ourselves with knowledge today. Remember, staying informed is the first step towards a healthier life.